here I have my supplies that we're going to use. So I have my patient medical record, I have my eye drops that I will place first, and then I have the eye ointment. Now, it is important when we are getting ready to use them that we keep the tip of the bottle sterile, because we do not want to contaminate the eye of our patient, which could further add to infections or other complications. Now, with our patient here, what we will do is we will instill drops into one eye and we'll instill ointment into the other for demonstration purposes. Keeping the tip of my ophthalmic drops sterile, I'm going to instill 2 drops into her right eye. What I'm going to do is, you'll notice that I have the base of my hand resting on her skull. So that way I have great control. So if the patient moves, I am moving with them to prevent me from damaging her eye. If I had my hand like this and she jumped up, she would jump right into the tip of the container and it could cause corneal damage. What you can do is you can use your pinky, if it helps, to lift up the upper lid. Sometimes they'll fight you. What I try to do is I take the base of my hand and pull down on the lower conjunctiva. Notice that I have the tip of the eye drops pointing down, and I'm using my middle finger here to pull up, and I'm going to instill 2 drops. The first drop missed, and then I just let her close her eye. Now I'm going to do the same thing in the other eye. If I was going to need to instill this ointment medication into the same eye, I would wait at least 5 minutes to let those eye drops absorb and then place the ointment. I'm going to take the lid off, maintaining sterility, and you can see a little bit of the ointment is starting to come out. Because this is the other eye, I'm now going on the top of her head and using my pinky to pull down on her conjunctival sac, and I'm not touching the end of that ointment into her eye. Notice how I gently squeezed it and then it fell into the conjunctival sac, maintaining sterility. And then I like to just let them close it and make sure that that ointment spreads over their eye to get good coverage. Good girl. Then I can replace the caps to ensure that my medications stay sterile. What we're going to use today is a flea medication, and I have the flea medication here and I have my patient's medical record. It's important when you're giving the flea medication that you know your patient's weight and that you're giving the appropriate dose for your patient's body size. Notice how the restrainer automatically moved the collar forward. The reason for this being is that when we place our topical medication, we're typically placing it on their dorsal neck or in between their shoulder blades, as to prevent the patients from ingesting it if they go to groom themselves afterwards. I'm going to untwist my medication. This one I have to take the lid and just place it over top. Little twist. Now I can see that it's open. Now what I'm going to do is I'm going to part the fur so I can see the skin area. And I want to make sure that when I'm applying it, that the medication goes directly into onto the skin, not onto the fur. Stay. So I'm going to place a couple drops. I'm just rubbing it in there. With your larger patients, you're going to have a larger volume, so sometimes you can do a few areas of application. So I'm pushing onto the skin. I can see that it's absorbing onto there. Maybe do one more spot just over here. You can see, and I have nothing left in my medication ampule.